In 2017, I received a call from an orthopedic surgeon in the UK while I was working at NASA. And he said, "Do you want to come with me and change the world and how they close wounds?" I quit my job at NASA, and my wife and I moved to Ireland. So everybody in this crowd will have a wound closed in your lifetime. I'm sorry to say it, you're going to have a knee replaced, a hip replaced, maybe a C-section, maybe you just end up in A&E. But everybody will have a wound closed. There's 230 million surgeries done every year. That's 450 surgeries a second. 450 a second. Now, the gold standard for these closures is suturing, or stitching the wound closed. This can be quite slow. And this time does have a cost. In monetary costs, it's $60 to $200 per minute. But in patient costs, if you keep an 80-year-old woman under general anesthesia for an extra 30 minutes, you may have just doubled the chances she never wakes up. Now, there is an alternative. There's surgical staplers, and they can be quite fast. You can close a 20-minute wound in less than a minute, but they have their own drawbacks. Infection rates. If you close a C-section wound with sutures, it's 5%. Surgical staplers, 10%. They also leave those telltale railroad track scars, and the patients complain that they can be quite painful. So there is clearly a clinical need for a wound closure device as fast and convenient as surgical staplers, with all the clinical advantages of meticulous sutures. So our team at Starling Surgical is proud to introduce Quickstitch. Now, the market for wound closure is huge. It's a $7 billion market. Half of that is sutures and staples. Our device will account for $2 billion of that. Our beachhead strategy is obstetrics and orthopedics, which is an $800 million market. Our preclinical results of this patent-pending platform technology received rave reviews at BAPRAS, the largest plastic surgery conference in the UK. To date, we've raised over €1 million in non-diluted funding from Enterprise Ireland and EIT Health collectively. Our regulatory pathway is a 510(k) approval, and we're targeting submission of Q3 2020. We're currently raising our Series A round, and we'll close that in Q4 of 2020. We'll also spin out of Trinity College at that time. So in summary, we have a $2 billion market, a novel technology, a team with expertise and experience, and a clear implementation strategy. When your wound's closed, you'll want Quickstitch.